General Hospital's polarity is that Hamilton Finn is spiraling downhill and can barely maintain his sanity. Losing Gregory's chase made Finn desperate and no longer wanted to continue with his life and career, but because of Violet Finn, Finn had to keep trying. With staying sober becoming more difficult than ever, and to make matters worse, Finn has also started using alcohol again and Wilson relapsed. It becomes more difficult for Finn to maintain his job at the hospital and nearly put several patients in danger. Finn would join other family members and relatives of Gregory's in organizing Gregory's funeral. During the funeral, Finn may cause trouble because of his drunken state. Then, when Gregory's funeral is complete, Finn's return to his old job at the hospital. Finn will be under pressure when thinking about Gregory, and Finn will not be able to maintain alertness throughout the workdays. Finn then secretly drinks and is possibly caught by Liz. Of course, Liz begins to fear that Finn's drunkenness will make him unable to concentrate at work. That could cause Finn to give the wrong diagnosis to one or refuse patient. Liz could advise Finn to temporarily quit his job and go somewhere to calm himself down. But Finn refused, and indeed, what would happen would happen. That's when Finn must diagnose a patient, which nearly cost that patient his life. Luckily, Finn was later able to overcome the damage with Lee's help, after which Finn asked Liz to keep the secret. Liz agreed, but the patient's life is more important, and Liz decided to tell Portia Robinson, so that Portia could intervene and decide to temporarily lay off Finn. Immediately, Finn knew Liz had revealed the secret, and because of this, Finn decided to end it with Liz. Finn also fell into a more desperate state when he tried to stay awake but fell. Finn then probably wanted to let go of everything. Finn left her will and decided to end his own life. When Liz and Brooklyn Quarterman, along with her recent chase, arrived, it appeared that Finn had really passed away. Finn knew that if he continued to work at the hospital, the patient could die. If Finn could not maintain his sanity, and Finn also made it clear in his will that Finn knew what he was doing. Violet could be left in Lee's care through what Finn wrote in his will. Of course, Finn doesn't want to bother the young couple Brooklands and Chase. They need to have their own child. Lee shed tears when she lost her boyfriend. Liz had gone through so much suffering in life, but by becoming Violet's adoptive mothers, Liz felt somewhat comforted. Ultimately, all of Finn's assets would go to Liz so that Liz can take care of Violet until she is 18 years old. His death will also leave Chase and Violet regretful. In addition, Violet will find it difficult to accept that she had just lost her grandfather and now has to lose her biological father. Violet became an orphan in a short time, and all the townspeople mourned for her.